To the OC show, the Fitness Mastermind. I'm your host, Omar Cordero, VIP celebrity fitness trainer and director of the NFSI. Our shows are always dedicated to three things. It's to inspire, to motivate, and educate our viewers. It's very important that we at least hit one of those components every time you see this show. We got a special guest today, Dr. Reyes-Ayala. This is going to be a very interesting one because, again, we are combining health and wellness with medicine. So this is going to be real cool. So Dr. Reyes-Ayala, if you can go ahead and introduce yourself to our audience, who you are, your practice, and familiarize yourself with who you are.
Well, thank you, Omar, for having me on your show. I appreciated that. My name is Dr. Reyes-Ayala, internal medicine specialist here in South Florida, Miami, Coral Gables area. I'm originally from Puerto Rico, came to Jackson Memorial Hospital to do my training in internal medicine, did a fellowship in geriatrics, been practicing for the last 20 years in the community. Very happy
Yep.
to be here and as you know, because you're also my patient, so happy to be here to your show.
Yeah, no, this is also why it's very special as well, because I am his patient. I've been his patient for a very long time, and I will I will touch upon the fact that your level of expertise, right? Not only the science component, but the emotional component that you bring into the equation is huge, because I see how you handhold throughout the entire process, which, I have met many doctors in different specialties, and it's sometimes it gets a little cold, right? This is what it is. Okay, next. In your case, I see how you facilitate the entire process, how you actually care. I mean, you genuinely care about your patients, which I think is huge. And this is, a big component on why I've been your patient for such a long time. And that's important, because this is also it's a spinoff into fitness, because you have to care about your clients, right? It's not just, okay, here's an exercise. You need to know what is behind the scenes. What is the meat behind this? And how are we going to customize a program for your clients? So every industry or every category has the same fundamentals. This is the important aspect of it. But going back towards your practice, you've seen numerous patients throughout the years. And as the age-old thing, which we all know, is we're seeing more high blood pressure, people with high blood pressure, borderline diabetes or diabetes, cholesterol issues. I mean, this is something that's disturbing, and share with us the things that you normally see, and can it be prevented with diet, exercise, and things of that nature?
Well, first of all, going back to the point that you were saying, with the way that I practice, that I have my practice, the most important thing is that the patient has to be comfortable with the physician.
Yes.
If you don't feel comfortable with your doctor, you don't have that one-to-one communication, there's nothing that you're going to recommend is going to work.
Right.
Because the patients need to, first of all, they need to feel comfortable, but they also need to believe that what you're telling them, it's going to work, and that you're going to be there for them. That
right. They won't be as compliant.
Correct. Right? There's many doctors in the community, many good doctors.
Yeah.
Unfortunately, the time constraints that we have.
Yeah.
Every time that makes it very difficult. You have a lot of patients. Sometimes you don't have enough time. In my case, I try, it doesn't always happen, but I always try to give the time that the patient needs.
I see that firsthand.
And you know that besides me being your physician, you're also my trainer.
Yeah.
So we both know how each other works, and you see how that makes an impact on the patients.
Yep.
There's we always tried, as you were saying, this the different medical issues that we have working with the patients. Cardiovascular disease is still number one
I know.
cause of death.
It's insane.
We have there's a lot of things that we cannot change. We cannot change that we get older. We cannot change our sex. But there's a lot of things that we can modify. Like you were saying, there's a few culprits in the treatments and in the conditions that we see. Hypertension being number one, dyslipidemia or high cholesterol,
Right.
Diabetes. All those are increasing and let's face it, in our community, there's a lot of Hispanics. Our diet is not the best,
That's right.
and
Yeah.
we just need to keep trying and educate the patients on eating better, exercise. But like you were saying, you say, okay, exercise and that is
Yeah.
very easy said,
Right. Very easily said, but what's behind the meat?
right, and not easy. It's
Right.
not as easy to do it. But you just, like when I talk to my patients, you said you just have to keep trying and doing it. And this is not a matter of just do a month. Let's do this for a month. This is a lifestyle change.
That's right. Which is one of the biggest errors people do. They think it's, oh, I'm going to do it for a month and it's going to get better and that's it.
And a lot of hype diets, you see people, oh, I'm going to do intermittent fasting, or I'm going to do keto diet, or I'm going to do this, I'm going to do that. But they don't stick to the program. They don't stick to the fact that this is not a matter of doing this for 30 days. This is a lifetime commitment.
That's the most difficult, that's the most difficult part, because I see this on a daily basis, especially when people start to train. You see how it gets very difficult because they want a quick fix.
Correct.
And I tell them right off the bat, there's no quick fix. Now, I can write a diet and you would lose weight within 30 days like you would never imagine. You'd be like, wow, this works. But there's a caveat. The sustainability.
Correct.
It's not going to be sustainable. So the same way that you lose the weight, you're going to gain it back or more because of metabolic issues. I mean, now you're kind of messing around with the system. So there's so many things. You mentioned diets. Diets is another important thing because we've all tried different diets. We've had the Atkins, the keto, the zone, the paleo. I mean, there's so many different diets out there. They all work. Don't get me wrong, they work. But is it what's the sustainability component to this? Can you sustain this for the rest of your life? And the answer is probably not. It's difficult.
The problem also is that not every diet works for every single patient.
And exactly.
Every single body is different, as you know.
Yes.
And every single person has a different DNA. Everybody has a different, it's a different metabolism.
Man, that's right.
They have different, the genetic component is important.
I'm glad you say that.
And everybody pretty much goes with whatever the neighbor tells them or the best friend tells them, and this and that. And it worked for them, but it not necessarily means that they're going to work for the other ones. They don't know what medical issues they have.
That's right.
So you have to be very careful, because it happens to me in my practice many days, and I see it every day. For example, somebody goes, oh, I was doing keto diet, and all of a sudden you check on the lipid profile and the cholesterol is through the roof. They're like dying and they don't know about it.
I know.
And all of a sudden they have elevated liver enzymes, for example. So you got to be very, very careful, specifically the people that are overweight and that they have, for whatever reason, they may have not been doing, a good program, and they want to do something for a New Year's resolution or whatever, and that it doesn't always work.
Right, the famous New Year's resolution. Excuse me. But we have the famous New Year's resolution when it's like, all right, I am ready for the New Year's. We're going to tackle this. And then I have seen this over the years. It's like a book, right? I mean, I could just turn the next page and I know what's going to happen. 6 or 7 months down the line, the question is the following: remember when you started on January 1st, how close are you to your goals? And the majority of them are like, oh my God, I completely either forgot about it or I threw in the towel around February or March. And that's the issue that we encounter on a daily basis, because like you said, people know the information, they just can't stick with it. And then, they tend to listen to their closest, the people that they're closest with sometimes, which, like you said as well, is just because it works for one individual doesn't work for another. Biologically, we are all different. And I'm so glad he said this, because I've always said this, especially in our sit down consultations. When we sit down with a client and they're like, oh, I want to try this, I want to try this diet, will it work? And my answer is, I don't know. We're going to try because I need to see how your body reacts. We got to see how the body reacts to what we're doing there. Some people might have awesome results. Other people are just, nothing's going to happen. And we need to see what happens to that aspect of it. I mean, it's so important that you say these. And now, talk to us a little bit. What happens behind the scenes, right? Because a lot of us know diet. Forget diet for right now. Let's think of exercise. Exercise. If we exercise, it helps lower blood pressure. If it helps lower blood pressure, it helps lower cholesterol. If it helps lower cholesterol, chances are it has an effect on other underlying issues that could happen or any of that. But what really happens, not to get so scientific, but kind of in layman terms, what happens with exercise?
I'll tell you what happens. And in the majority of cases, because as we were saying, some people have some genetics, and you've seen 70 and 80 years old that they're amazing, and they're not taking one medication.
Correct.
But that's not the majority of the people. As we get older, our physiology changes. Okay, our blood, our arteries get harder. For example, our pancreas that reduces the amount of insulin that they produce.
Right.
Okay. The liver starts collecting more. The tissue becomes more fatty. This is changes that these are normal changes in our physiology.
Right.
Our body gets older. All right. But and there's things that we can do about it. We can, exercise is very, very important. Okay. To maintain our body weights, to make sure that metabolism is active, because the metabolism starts to slow down. As we exercise, we get that metabolism working again, and speeding it up. All right, which is part of the reasons why we gain the weight. All of a sudden, when we were younger, we were able to metabolize that fast food or whatever, whatever.
That's right.
Trash you were eating. All of a sudden, that about
not the case anymore. Right.
So exercise is key. I mean, as is diet, and they all, as they go hand in hand.
Sure.
I mean, if you exercise as you do, and you don't, I mean, you're a perfect example. You're a trainer. You're exercising from the time that you wake up in the morning. But I also see you. I see you what you eat.
Right.
You prepare your meals.
Yep.
You do your diets in a
right, which is important, because I don't follow a particular diet. This is the important part. I do not follow a particular diet. I take pieces of different diets and I put them all together. If one day I want to do this, I'll do this. If another day I want to do this, I'll do this, because it creates a sustainable atmosphere. That's the key. But
exactly.
Yeah.
And then, we have to do this we have to do this in a balanced situation. But staying at home, forgetting about it, is just sitting down on the couch watching TV. It's not gonna help.
No.
And as I was saying, our bodies changes. Yeah. And this is what predisposes. We already have a predisposition for certain conditions. Yeah. Maybe high blood pressure, could be diabetes.
We have to fight that on a
We have to fight it. We have to fight it. And the exercise is going to help. It's going to help to do that. At different levels, but the majority, just not to get very technical, we're speeding up our metabolisms, and we're fighting the getting, we're gonna see get old.
Yeah.
But we're gonna get that aging process. We're gonna try to slow it down a little bit.
And that's the thing. I mean, nowadays we have so many things, at our disposal, but again, technologies and everything is changing on a constant basis. I will tell you this: we are aging, all of us, right? From the moment you're born, I mean, literally from the moment you die, we are aging every single day, and it's horrible when you think about it, but it's the reality. So we try to utilize the things that we have at our disposal to kind of stop that process or kind of prolong it,
Correct.
using the data that we have, right? Because
Correct.
data is changing on a constant basis. Number one, the foundation of it is exercise. Why? And I said it before in another show, which was, if you notice the people that exercise, most of them, not all, because again, there's genetic reasons that come into play, but most of them that exercise, they look at least, I would say, 10 years younger than what their current age is. And those that don't exercise typically look their age or older. That's the key foundation on why we need to implement some sort of program. And I say program because there's so much more than meets the eye. There's so many components of fitness, especially as you get older, right? As you get older, so many components come into play, and we have to understand that it's not just one category, but we have to bring all the categories of coordination, balance, agility. I mean, the list goes on, strength, into the equation to have a more overall health, wellness, and fitness component into your life. Now, speaking of aging, the big thing now, okay, because this has been, I mean, obviously this has been going on since the 80s or probably even the 70s, but it's becoming more mainstream and all that. So, the whole anti-aging clinics that
Right.
come out, we see it day in, day out. Women has definitely have had a lot of access to hormones more than men years back through OBGs, through their OBGs
Correct.
and things through these physicians. Now, men, right? So we see, women go through menopause, men go through andropause, right? The effects is it just depends on the individual, but, the women will have, a lot of these effects, through their menopausal stages. But men have other types of effect, maybe not as known, but more physiologically, and they feel it, right? They feel different. So, the age old, testosterone that we see, a lot of these guys, this is a big, big thing. They're, that take testosterone and things like that. Let's talk about a little bit of the good, the bad, and the ugly, because it is an amazing drug from what I've seen for most men. Now, I say most men, but there's other things that come into play with these type of drugs when people are taking it. What are the risk factors, and especially the ones that are not going through medical supervision? That's the one that blows my mind.
Right.
But
So, as you said, this was getting very, very common and very known issue for the women initially, because as we all know, when the women gets closer to menopause, and the hormone starts to drop, the hormone level starts to drop, they get a certain medical conditions, specifically osteoporosis. That was one of the big
one,
ones.
yeah.
And they became, we started to know in the medical studies that with osteoporosis, the women started getting bone fractures spontaneously, and this was directly correlated to the amount of estrogens in their system. So as we have to be very cautious also, because as the risk for breast cancer it starts to increase also as the women get older, and even younger females. So the replacement of hormones, you got to be very cautious because of the cancer,
right? Or how people react to it, right?
Correct.
Like you said,
but a big one is the issue with cancers. Now, moving to the male area, this kind of like with the andropause, as men notice how the hormone deficit
decline. I mean, I think it's as early as age 30 in most men, right?
It starts to, it varies, but I have patients that they have very low testosterone levels at the age 30s, and they feel it, because sometimes the patients don't have a lot of symptoms with it,
right?
For certain, and again the genetic component comes into play, but some people starts having severe symptoms, specifically in the amount of strength of the stamina that you have. And we're not only talking about sexual component. Yes, there's issues with the libido, with the libido. I'm sorry,
Right.
with the libido, and you also have a lot of psychology component also with erectile dysfunction and all that
Sure.
part.
Yeah.
But the most the main complaint is that people, they don't have the stamina, they don't have the strength anymore,
The energy,
the
low
energy.
Yeah.
There's no energy for exercise. People are falling asleep and at work. They just can't get enough energy to finish the day.
Yeah.
So
day in, day out.
also, as you well know, being a trainer, there's also the cosmetic component,
That's right.
and the issue of abuse of the hormones, because the young guys, they have a good testosterone level,
Right.
but they want to become more muscular, they want to become they want to look better, they want to you know uh,
And it's unfortunate. And it's unfortunate because many of them, especially in their 20s, when they start taking either testosterone or other type of drugs, yeah, it's great. It's going to work. But there's a high likelihood that it's going to affect their long-term natural production going forward, which they have to be more reliant on it in the future.
Correct, because most of these young individuals, since they are not, it's not a medical condition,
Right.
that they are requiring a medical substitute of the
Sure.
hormone, they tend to get these at another type of
Underground laboratory or
correct.
someone off the street in the black market. I mean, it's
Correct. And since they're doing it like that, they're not medically supervised. So this is when you were talking about side effects and about risks of doing this. I mean, the risk of these guys getting conditions that affect them is very high. Specifically, they get liver toxicity. As you say, the natural production of the testosterone
gets hindered to some point. Yeah.
The testicles, they're just shriveled up, basically.
Yeah.
Because there's the amount of testosterone that they have in their systems is so elevated
That the body just says,
the body
forget
says,
it.
"Well, forget it. I'm not even gonna even try
Yeah.
to produce any."
Right.
And by the time that they stop, because at some point they're gonna have to either stop it, or the natural production of testosterone might not be there
Might not be there
anymore.
Yeah.
And it's very unfortunate, but it's very important. Usually the young individuals that are doing testosterone, they're also doing some other type of substance.
Right. That's
when it becomes a big problem.
Yeah. And it becomes it's a psychological abuse. It's a psychological abuse.
When they see themselves in the mirror.
Yeah.
I mean, you might be telling them, "Oh my God," but they want more.
Yeah.
They want more.
It's
and
the whole bigorexia, which is the opposite of anorexia.
And I see that, and I see it every day. And that's when you start seeing abuse with anabolic steroids.
Yeah.
I mean, you know them all.
Yeah, and it's interesting because I really want to touch upon from a physiological level, right? So let's say there's many benefits, right? Many benefits to the use of testosterone, as we know, but most of us really don't dive deep from a side effect point of view, because we all know most of us, especially you being in the medical field, know of the usual type of side effects, the gynecomastia, which is little fatty tissues in the breasts, the testicular atrophy, the testicles shrinking, and throwing where natural production levels could just go out of whack. And there's other drugs that you can take into play.
The most important thing is that if you feel like that, if the patients start feeling weak, there's having low energy, go check with your physician. Go get checked up. Go get testosterone levels.
Yeah.
Get your medical follow-up. Okay. There is help. There is a right way of doing things, and I cannot stress that enough. You have to check. Go be supervised.
Yeah.
Whatever you do, just get supervised. Have your physician check on your hormone levels. Have your physician do your physical examination. Like you said, you need to do a head-to-toe examination.
That's right.
Check. Be responsible.
And that's the key.
And that's the key.
It's that constant monitoring on what's happening, because at any time it could turn on you. It could be great. I mean, it's so many beneficial things that come with this, but we have to put into also consideration, which most of us never really talk about, is the following. Things of like, endothelial degeneration of, the arteries over time, long-term use, 20 years, 30 years, because there's people on this. It's a possibility, not, in high dosages. Nobody ever really talks about that, but it is something that could happen. That's why you have to go get monitored. See your cardiologist, right? See your endocrinologist when you are coming off something like this, so they can guide you, right? Is your natural production level coming up, coming down? What can you do? Other people that abuse the drugs, right? There's a left ventricle hypertrophy.
Yeah, I mean, correct. The important thing here is that, first of all, you need to check why is the reason why you have a low natural.
Correct.
You have to check. That's right. You have to go to the underlying cause of it. Okay, before you start supplementing it, you have to know why is the cause of it. It might be something natural. It may be not. It could be a hormone disorder.
Right.
It could be some medication that you're taking. It could be whatever, So the important thing is that you need to be supervised.
Yeah.
You have to be checked by a licensed professional. Then once you start, if the answer is hormone replacement,
right, and it's medically necessary,
right, and that is the right the key word,
right plan, or the right plan for that individual.
And right. then after that, then you're gonna check on everything what you've been saying. You check on the side effects. You check on all the different systems where this hormone is gonna affect, and the honest truth is that not everybody needs to have their testosterone replaced. And
I agree.
And it's there's a subset of patients that really need the hormone.
Sure.
Obviously, as these things gets popular with the anti-aging,
right,
and it's gonna be more used.
Yeah, and more mainstream. People are gonna be talking about it more, as we see now. I mean, 10 years ago, you wouldn't hear about this much.
Not as much.
Right.
And now everywhere you go, this is what they hear.
Exactly.
And but you just have to be careful. You just have to make sure that you monitor yourself and in a supervised setting.
No, and that's
I cannot stress that enough.
Yeah, and that's the key. I am so excited that you're here, because we could talk a storm. There's so many subject matters and so many different things that we can add value to the viewers, right? Because again, I can't hone on this enough. Medicine with health and wellness just kind of blend in together, and you don't see this often because they're kind of in two different worlds, right? Medicine says, do this. Health and wellness, or the fitness world, says do this, but they're never blended and never come into existence to actually give a holistic approach to a client/patient. And I think the fact that we're having these talks is very informative, to especially the end user who's seeing this going, wow, you know what? I mean, now we're seeing, two authoritative figures, one that's in medicine, another one that's in fitness, and they're really talking, exactly what I want to hear. So, that's the importance of it. I'm so glad you're here. Let's see if we can get them back on here soon.
Sure.
Because we're just about out of time. But again, I really hope that this has been a very informative show for you guys here at the OC Show. And if you want to hear more topics, if there's anything else that's just kind of out there that you have questions on, please put it on the chat. Send us an email, to either Miami Community Newspapers, either to us. My email, I think we have it here as well, but if you guys don't have it there, it's real simple. It's info@NFSI, right? Just that you see down there, that little NFSI logo right there. info@NFSIhealth.com. I'll say it one more time. That's info@NFSIhealth.com. Questions, anything, send us an email on stuff that you would like for us to talk about, and let's inform the public on, you know, what we know through our knowledge base, the best data available, and we'll definitely you know, go from there and make it a fun show. So thank you again. We hope you enjoyed it.
Thank you, sir.
For being on.
Thank you for having me.
Absolutely. And we'll see you next time on the OC Show.